Hey everyone, welcome back to Static Pharmacology here on EMTV. I'll be giving you a patient care scenario, and your goal is to develop a treatment plan using only medications. For an added challenge, there'll be a timer on the bottom of the screen for 1 minute. When the time is up, I'll go over the scenario and then give you my treatment. Enjoy the card, and good luck.
3, 2, 1.
So the scenario I gave you today is an all too common one. No doubt you've probably run patients like this yourself. Let's go ahead and take a look at the scenario in a little bit more detail. So you're dispatched to a local convenience store with the police for a behavioral emergency. Upon arrival, you notice your patient, an approximately 55-year-old male, is stumbling around the store yelling at the clerk. He denies any medical problems, but is unable to recall the current day of the week or where he is. Your partner obtains the following vital signs: blood pressure 106/62, pulse of 128, respiratory rate 24, SpO2 97 on room air, and a blood sugar of 25. Pupils are perla, and he passes a prehospital stroke scale without any deficits. So this scenario illustrates what you may already know: the importance of checking a blood sugar on a patient who's altered. In fact, I have a pro tip about it if you want to check that video out. This patient is displaying classical signs and symptoms of hypoglycemia. Fortunately, his blood sugar is high enough that he still has brain function and he hasn't begun seizing yet. The treatment I'm going to describe is very common, and we're not really going to get into the weeds with this. So let's go ahead and go over that now. So just like with all my other static videos, I'll begin treatment by regurgitating the mantra, scene safe, BSI, IV O2 monitor. Now, as this patient is hypoglycemic, the mainstay of our treatment is going to revolve around the administration of dextrose and other agents to improve his blood sugar. My anti-hypoglycemic agent of choice is always going to be D50. An adult dose typically starts at 25 grams, and this is also known as an AMP, so it's a single pre-filled syringe of D50. Alternatively, if IV access isn't available, you can administer glucagon, 1 mg IM. It's important to note though that glucagon relies on adequate stores of glycogen in the liver, so if your patient is malnourished or if they've been exerting themselves heavily, they may not have an adequate store of glycogen available to them in order to correct their hypoglycemia. You could also give D10 or any other iteration of D50 if you don't have a patent line or a decently patent line. D50, if you've never pushed it before, is like pushing molasses. You have to have a very large IV, and you have to make sure it's patent, otherwise the medication will infiltrate or extravasate rather, and this will cause tissue damage. So some protocols push for the use now of D25 to prevent this, others push for the use of D10. Whatever dextrose containing solution you have, with the exception of course of D5, you're not going to get an adequate increase in blood sugar with D5 infusions. Go ahead and administer the D25, D50, or D10, and you can repeat this as often as necessary. After you've given your medications, recheck your glucose level, and if needed, re-administer the medications. And then finally, rapid transport. And that's it. If you like this video, please make sure to subscribe to my channel for more. Until I see you next time, keep washing your hands and have a good rest of your night.